Hey sister, do you remember that soccer player I was talking to you about the other day, Andrew Cole?
Go away. Wait, who? You mean Andy Cole? Give me a recap of who he is.
Yeah, that guy. An Englishman who played for Manchester United for most of his career, with a few years with Newcastle United. Well, I was doing some research about him for some schoolwork, and turns out he's had multiple shin splints. Multiple.
Shin Splints? What are those again?
Shin splints are defined by Better Health Victoria as a term that is referring to pain felt anywhere along the shin bone from knee to ankle. Usually, people who play sports that involve a lot of running are prone to shin splints, like footballers, tennis players, and basketballers. People with flat feet also get shin splints due to the fact that shin muscles help maintain the arch of the foot. But since some people have flat feet, it pulls at the shin tendons, causing slight tearing. The excessive force on the shin bone swells up the area and increases the pressure against the bone, causing pain and inflammation.
So, how do you know if you have shin splints?
Some symptoms of shin splints include aches, pains, and redness along the shin bone, tenderness and soreness when touched, and pain felt before, during, or after running.
Why would it happen to such a cool person like Andy Cole?
As a soccer player, obviously you're doing a lot of running, so shin splints are just part of playing sports that involve running, I guess. Causes of his shin splints were because of overuse during his games and intensive training. During a game in 1995, he was sidelined because of his shin splints the first time it happened. Another time he suffered was at the start of his warm-up, when the pain arose again. Factors that may contribute to shin splints in general include incorrect technique, where you might be rolling your feet inwards, which strains your muscles and tendons. High impact activities, where you're running on hard or uneven surfaces, which can injure the shin muscles and tendons. And wearing incorrect footwear that isn't appropriate for your sport. An example of this is at school when people forget to bring their sports shoes and wear their school shoes and play sports in them.
How would one recover from it?
In Andy Cole's situation, he spent his time resting his leg and icing it, which meant missing out on trainings and matches. He also went to see a few specialists to get checked up. These little shin splints definitely didn't stop him from playing though. After rehabilitating, he jumped right back into the sporting community again. Nothing could ever stop that man from continuing until he retired. I can give you a more in-depth explanation of how he could have treated it better. You want to hear it?
Okay, sure.
Shin splints are normally diagnosed by a physiotherapist based on your medical history with a physical examination, with some cases including an X-ray or other imaging studies to identify causes of pain. Then your doctor will determine on the best pathway to your recovery, depending on the severity of each case. Generally, the treatment necessary for shin splints are as follows. There is the first stage, which is phase 1, early injury protection, pain reduction, and anti-inflammatory phase. This is the early phase where you may be unable to walk or run without pain, so the best recommendation is to have as much rest as possible to relieve your shin muscles and bones, or your physiotherapist may give advice on what may be best for you. It involves applying an ice pack to injury for 20 to 30 minutes, 3 or 4 times daily to reduce the swelling and pain, and taking anti-inflammatory painkillers such as ibuprofen, naproxen sodium, and acetaminophen to further help with your pain and swelling. While you improve during this stage, utilizing kinesio style supportive taping or elastic compression bandages may support the wounded soft tissue and alleviate tension in your shin bone. Next is phase 2, regain full range of motion. This phase involves protection of your injured shin muscles while they heal and recover, which will take up to a few weeks, which is when you aim to maximally remold the scar tissue to avoid having a tear-prone, poorly formed scar. During this stage, you should massage your shins with a foam roller, perform muscle exercises, neurodynamic mobilizations, and specific exercises as advised by your physiotherapist to orientate and lengthen the healing scar tissue. After is phase 3, normalize foot biomechanics. Common causes of shin splints may be from poor foot mechanics, thus to minimize the possibility of reoccurrence, your foot should be examined. The phase involves either acquiring a foot orthotic or taking part in the active foot posture stabilization program to correct your foot mechanics as directed by your physiotherapist. Then phase 4, restore muscle strength, is up. This is when you strengthen your calf and shin muscles via specific training exercises to enable safe resumption of sport or training. Engaging in low impact and low intensity exercises or sports such as walking or swimming should be done. Finally, there's phase 5, modified training program and return to sport. As most shin splints result from overloaded training, preventing a recurrence when returning to your sport may mean having alterations or guidelines. You would be given training schedules and exercises for rehabilitation and improvement in sporting performance. Sport-specific exercises may be given with the addition of a progress training regimen to optimize your recovery so that you can completely return to your sport with full health. However, in rare cases, if shin splints exhibit severe pain or symptoms don't subside after a few months, surgery may be issued by your doctor. This is called fasciotomy, which involves small cuts in the fascia tissue surrounding calf muscles to relieve pain.
Shin splints seem to be a tiny problem, but how could we prevent or minimize it from happening?
Here are some ways to prevent shin splints with athlete preparedness. Have a thorough warm-up before exercising. Make sure to include slow, sustained stretches in your cool-down. Implement a regular routine for stretching into your workouts. Work on strengthening your lower leg muscles with specific exercises such as calf raises. Running on flat, softer ground such as running tracks or grassy ovals. Restraining your training intensity or increase gradually. Utilize shock-absorbing insoles in your running shoes. Wear quality running shoes and changing them when worn out. Cross-train with low-impact activities such as cycling, swimming, or walking. You can also seek advice from the same health professionals from treatment, such as podiatrists, to have a foot and ankle checkup for diagnosis and see what is recommended for your feet type, such as special beneficial shoe inserts for flat feet. Physiotherapists, to correct any relevant biomechanical factors that may impact your running style, such as tight or imbalanced muscles. They may recommend exercises or taping for legs. Exercise physiologists, to gain advice on how to improve and refine your running technique to further prevent risk of shin splints. Chiropractor, who watch you walk or run to identify risk areas then press on or around joints to relieve pain or tension surrounding muscles and joints.